Welcome to our webinar, What Have We Learned from COVID So Far? I always joke about the title. Nothing, no. With Dr. Liz Pellicano from the University College London. Those of you who joined early were able to partake in our virtual exhibit of autistic artists, exhibited by Tangle Arts Plus Disability in Toronto. Those who missed it can view it on Restoring Autism website in the information that we will send after this webinar. I am Marella Advocate at the Israeli Adult Neurodevelopmental Center here at CAMH. We collectively lived through an unprecedented event, the COVID pandemic. Governments were initially copying countries that were affected first, such as Italy. It was mostly a wait and see and make it as we go along approach, because the novel in the word novel meant novel virus. We've all faced isolation during lockdown and this new way of living. Anxiety was stirred from not being able to see loved ones. The pandemic became politicized. Some governments put economic consideration over public health in some places. Disabled communities felt they were seen as disposable. We heard COVID spreading like wildfire for people living in congregated spaces. Stories of do not resuscitate were used in hospital triages where they used Napoleonic battlefield medicine to determine who got beds and ventilators. The facade of a civic-minded community started to unravel when people dismissed the COVID as the flu. We were not all this together. Commodity became a dog whistle to explain why those people died, be it age, diabetes, obesity, or an unhealthy lifestyle, to somehow imply it was their fault. Autistic people saw the same rationale that anti-vaxxers used to disseminate fear about MMR vaccine. With the COVID vaccine, with the rise of anti-science fake media overtaking society, even Robert F. Kennedy Jr. and his anti-vaccine rhetoric and the bleach cure-all got recycled. Autism quack re-entered COVID mainstream. The ableism, the ageism, and the fat phobia were the result. Uneven access to the first vaccine rollout, where a person with Down syndrome who lived at home with their parents did not get priority to vaccinate, unlike their cohorts in group homes. Staff were hard to come by, with burnouts, quitting, and those refused vaccines. Some autistics who worked as frontline workers in elderly care felt the burnout, but were given vaccine first. Psychologically, it was difficult for many. Parents groups went to the media, complained that their children's autistic services were halted. Autistic adults were used to a certain type of isolation, also saw their social programs paused, even though autistic adults get few services anyway. The world moved virtually with telehealth and remote working as part of this new normal, which many NTs enjoy, neurotypicals. Some working artistics also, at first liked it at first, but not being pressured for small chat socialization at the office. The Disability Justice Network of Ontario came up with their 15 recommendations from their COVID survey based on needs and experiences of disabled people. Many autistics have chronic conditions and decreased immunity, which oblige them to continue wearing masks contrary to the masses. COVID wasn't over for many disabled people just because it was declared so by politicians. Distrust of government culminated in Canada with the Freedom Convoy, where truckers, the unvaccinated, far-right terrorists, the populist politician converged. Friendships were affected, relationships severed for both neurotypicals and autistics due to time spent apart and philosophical divisions. 3 years of loss, physical loss, psychological loss, that we collectively survived. Dr. Tam was right when she announced in 2020 that this could last into 2023. 6 million people worldwide dead, according to the WHO, and 3 million in 2020 alone. Long COVID, now called post-COVID condition PCC, affected many able bodies, creating a new disability status with unknown neurological vascular consequences that will continue to affect them. And people are still dying. Suffice to say, COVID has been controversial event. Without further delay, here is Dr. Liz Pellicano, who authored many studies on how COVID affected autistics. She will give us a global perspective as an Australian working in the UK and our first speaker from outside Canada. She is a professor of autism research at University College London, having recently been professor at Macquarie University in Sydney, Australia. Previously, she was a professor of autism education and the director of Center for Research in Autism and Education at UCL Institute of Education. Her most recent research focusing identifying ways to bridge the gap between lab and life and open up research to greater involvement of the autistic people themselves. So here's Liz and the presentation.
Wow. Morella, I'm not sure I actually need to give a presentation after yours. It's amazing. Yeah, phenomenal summary of what's been going on in these past few years. Thank you so much for inviting me to give this talk. I'm just going to share my slides, and I can't seem to speak at the same time, so bear with me for 1 second. Screen and present. Oh. Yeah, is that all good? Yeah, excellent. Okay. Yeah, thank you so much, and it's really lovely to be with you. Obviously not in Canada, I'm in London, but really, I'm really pleased to be able to share some of our findings from the work that we've done during the COVID-19 pandemic. As Morella just mentioned, my work is largely, about autism, autistic people. And especially the aspects of autism that have been overlooked by researchers, clinicians, and educators for far too long. So I'm going to talk today about what we've learned so far from autistic people and their families' experiences of the COVID-19 pandemic. And I've divided this talk into kind of 2 parts. In the first part, I'm going to tell you about a study that I ran from Australia with a large group of autistic people and their families about their experiences of that initial phase of the COVID-19 pandemic. So kind of March to May, June 2020. And I'm going to talk about the mental health impact of the pandemic, and particularly on autistic social connection. And then in the second part, I'm going to talk about a scoping review that we've recently done of the broader literature. So I'm going to tell you about those findings. And as I hope you'll see, I think the experience of the pandemic and its associated restrictions has revealed what matters to autistic children, young people, and adults in their lives, and therefore has implications for concepts around, notions of autistic flourishing, which I've spoken about before, as well as post-pandemic responses to it. Okay, that was a big preamble. Let me get started. So as Morella's just told us as well, COVID has taken a horrific toll on the lives, health and well-being of millions of people all across the world. And the measures needed to constrain it and to mitigate its worst effects have had their huge price too. So in many places all over the world, people were required to stay at home unless engaging in essential activities. And in Australia, where I was based at the time, the restrictions were some of the harshest anywhere. So schools moved online or stopped altogether. Restaurants, bars, theatres, museums all closed. People were told to work from home. Socialising with friends and family were halted. Australia's second largest city, which is Melbourne, well, actually now it's the largest city, apparently, was the most locked down city in the world, with stay-at-home orders in place for more than 260 days. understanding the impact of the pandemic on autistic people is crucially important for many reasons. But one of them is because it gives us the opportunity to get to grips with what matters most to autistic people. And as the Harvard professor Danielle Allen puts it, the fact that so many aspects of life were turned upside down during the pandemic gives us a chance to look again at the fundamentals of life. So she says, the pandemic reminded us that human flourishing should be our fundamental goal as a society, and that such flourishing extends beyond basic material and physical security, which of course we need, but it's not, surviving on its own is just not enough. The questions kind of, arise around, what did people really miss? What did they long for? What would have made a difference to them? And how can we make life better now and in the future? And early on, there was some really excellent research on these questions with regard to disabled people more broadly. So in this slide, you can see Tom Shakespeare and his colleagues' vital effort to describe the differential impact of the pandemic in their path-breaking Lancet paper in 2021. So Shakespeare and colleagues spelt out what they called the triple jeopardy facing disabled people. So they showed, I'll read out the quote for you. So people with disabilities have been differentially affected by COVID-19 because of three factors. One, the increased risk of poor outcomes from the disease itself. Two, reduced access to routine healthcare. And three, the adverse social impacts of efforts to mitigate the pandemic. They showed that those who were living in institutional residential settings, for example, witnessed levels of infection far in excess of those living in more conventional households. They showed that those who were dependent on key healthcare or other support services were also particularly at risk, as those services either shut down or become far too difficult to access. And they also talked about, those who are already living with mental health challenges like depression and anxiety were prone to respond far worse than others to government-mandated restrictions like the stay-at-home orders, which followed in most countries as the virus ripped through communities. Now, since Shakespeare's paper, a host of other large-scale studies have confirmed their central hypothesis. Those who were more vulnerable prior to the pandemic have tended to fare far worse than the overall population during it, facing challenges to their health, their social services, their economic well-being, far in excess of many others. And that was true of autistic people. Now, beyond Shakespeare's general observations, further reasons to suspect that autistic people would have found this period particularly difficult. So existing psychological research suggests that many autistic people face severe challenges to their well-being, well before the pandemic hits. Most autistic people have co-occurring mental health conditions, especially anxiety and depression. And they also frequently require additional services and supports within education and health sectors and social care, services and supports that were placed under threat because of the pandemic. Furthermore, we know that autistic people are often, thought to be uncomfortable with swift and unexpected change and to struggle with, future uncertainty. Despite all of this, some people predicted that autistic people would actually do okay in the pandemic, even that they might thrive. And some of these more optimistic voices base their views on the idea, that moving schools, works, therapies swiftly online, as occurred very early in the crisis, might have actually served autistic people very well. Others also argued that autistic people might be more adept at dealing with social distancing or physical distancing the non-autistic people, as they can find conventional social interactions unsettling, and that they would therefore enjoy the social distancing that others struggled with. Conventional autism science has, after all, long expected that autistic people, perhaps more than anyone, would have coped best with social isolation. After all, the very word autism comes from the Greek autos, or isolated self. And as one autistic adult described rather sarcastically in an interview that I did, they said, according to the theories, we self-isolate. We do that all our lives. So autistic people were ready for lockdown. So what we set out to do very early on during the pandemic was to reach a fine-grained understanding of what actually happened for autistic people during COVID-19. And it was an ambition that led me, together with 7 autistic and non-autistic collaborators from the UK and Australia, to organise the largest in-depth qualitative study on autistic people's experiences during the pandemic. And the autistic community's desire to take part in this project was immense. So I've never received such a response to an invitation to share views and perspectives. So within weeks of setting up our group, we'd spoken to 142 people, including 43 autistic adults, 83 parents of autistic children, 35 of whom were autistic themselves, and also 16 autistic young people, aged between 12 and 18. And they were often talking, for more than an hour each about their day-to-day experiences during the COVID-19 pandemic and the impact that they felt that it had on their lives. So on their living arrangements, their working arrangements, their learning arrangements, their social relationships, their access to services and their well-being, resulting in almost 7,000 minutes of recordings, which we then had to analyse, which is not easy. But what was, I think, most rewarding, I think, for me and the team, was that they were sharing stories of a kind of level of intensity and honesty that I hadn't come across before. And what we discovered is extremely compelling. Just before I talk to you about the results, I just want to talk the method that we used. So we used a qualitative approach, and this was important because at the time, people had started to do surveys about people's experiences. And while I have nothing against surveys, I just felt that, that as a team, we felt that, we were going to get a really rich understanding of people's experiences if we took a qualitative approach and used in-depth semi-structured interviews with people. So there was a qualitative approach, and we also used a participatory approach. That is the working together of autistic and non-autistic researchers and community members. And that had a huge impact on the work. So firstly, it impacted, the size and depth of the sample, so the community reach. I can tell you now that if I'd done this study without, the connections of our autistic co-researchers, it would have taken me months to recruit the number of people we ended up speaking to. They also, the team also influenced the kinds of questions that we asked and the way that they were asked, ensuring that, our interviews were really respectful and supportive of our autistic participants, particularly given that, as you'll see, they were talking about, some really hard, deep and deeply unsettling experiences. And finally, this participatory approach kind of impacted or influenced the analysis itself. So they my autistic co-researchers, drew attention to things that might have otherwise been missed. And that was, throughout all of our work for this particular study. So the research project the research team comprised of me, obviously, And then 3 autistic researchers, so Robin Stewart, Mel Hayworth, and Jacqueline Houting. And then we have Anna Ivanovitz, Simon Brett, Iliana Maggiati, and Mark Steers as a team, and that's how we approached our research. So what did we find? So as the optimists had suggested, some of our autistic interviewees did report enjoying some positive experiences during the earliest months of the pandemic. And in particular, they felt that, you know, the stay-at-home orders, what we called lockdown in Australia, freed them from some of the more overwhelming demands and expectations of living in a neurotypical world, you know, a world that isn't typically set up for them. Suddenly, some of the more pressing requirements usually placed on them, such as the need to fill in endless paperwork to, you know, to secure their insurance and welfare benefits, they were lifted. And as was the need to negotiate, you know, physically getting kids to school, heading off to work, doing the shopping, keeping the household running on top of everything else. Nonetheless, the overwhelming message was that this momentary sense of relief, or this kind of positivity, did not last. So in fact, within weeks, it was crowded out by a sense of, you know, often severe difficulty. And this difficulty did not just emanate from the first 2 of Shakespeare's most anxieties, so about the virus itself and about access to services and supports. Instead, it came from the third, the social implications of the pandemic experience. So our autistic participants, young people and adults, told us that they intensely missed seeing their friends. Zoom, FaceTime, Discord was said to be insufficient substitutes for the physical, embodied interactions with other people that make up most of day-to-day life. So in direct contrast to the orthodox view of autistic people as not caring about, you know, friendships as much as others, our participants talked about how they, you know, continued to keep in touch with their friends during lockdown through texting, Instagram, video chat, online games, but they were resoundingly clear about the extent to which they missed the face-to-face embodied physical interactions with their friends. So one young man said to me, you know, my friends, I really want to see them. I want to see my friends. People found staying at home challenging because all the social aspects of my life have been cut out. Some autistic adults were, you know, were visibly distressed by this aspect of lockdown. You know, one autistic woman said to me during an interview, you know, just not being able to see anyone has been really hard. I can't deal with being isolated like this. I just want to hug someone. And this was the case even for autistic adults who very clearly stated, I don't need a lot of human contact. But they also said, you know, but I've been really needing a lot more contact from my friends than I usually would. Another young person said, you know, I prefer hanging out with him, her best friend, in person as opposed to just over text. So I haven't been talking to him as much as I do, but still somewhat. I've really missed that. It's rare that I find somebody that I actually talk to in the first 5 minutes. I'm like, oh yes, I know everything about you because you're me with different interests. When I do, I've got to treasure that. Parents also described how much their children craved their friends. They mentioned their friends a lot more or were always asking when she could play with her friends. And our participants' social desire for social contact went further than their established kind of social circles and quality friendships. And they also said, often to their own surprise, that they missed the more incidental social contact in neighbourhoods or workplaces or community settings that they had once taken for granted or not even noticed, and that was now taken away. So as this autistic participant describes, not having much, or in some cases any, social contact during the COVID-19 lockdown period made them long for it. So this is again another woman I spoke to, she said, I didn't realize how important that incidental human contact was to me. It was so incidental that it never really registered on my radar until it was gone. The paying for the petrol at the service station or the gas station. As much as it shits me, because I work with an assistance dog, right? So everywhere I go, I've got this giant, white, majestic beast next to me. And so the soundtrack of my life is, oh my God, it's a dog. It's a beautiful dog. What kind is he? How old is he? What does he do? And that drives me bananas most of the time. And I've actually found myself even missing that. Another young person said to me in an interview, I think there are some students who at school are just always messing about and do get on my nerves. But now that I think about it, I'm almost longed to see them running down with a load of sweet packets, wanting to sell them to each other. I've realised how much I would actually miss them. Mind you, it isn't a lot, but I wasn't expecting to miss them at all. Not being able to have those physical connections with others also seemed to have a huge effect on people's mental health, as this autistic parent describes. She said, I've always looked at those sort of islands you see going, I could totally be a hermit and just live somewhere in the middle of nowhere and never see another person. Happy days. Because people are really exhausting. But this has taught me that actually I do need people. I think the first probably 6 weeks, I didn't have enough contact with people, and that made my mental health worse. The missing of deep social connection, and particularly incidental social contact, flies in the face of so many common stereotypes about what autistic people want and what they don't want. How many times have we heard it said that autistic people don't want friends? They prefer a life of social isolation. We even have prominent theoretical counts of autism that contend that autistic people have diminished social motivation. Our study clearly showed that this was not the case. The imposed isolation and the resulting, reduced pressure on having to interact with anyone revealed just how important social connection is. Moreover, this had real and implications for a series of concrete aspects of life. When it came to school or therapy, for example, our participants noted that the online connections simply weren't enough. So one young person that I spoke to summed it up. He said, just the idea of talking over Zoom and stuff is not the same as a real person. And the apparent unease in these online interactions had dire consequences. So autistic adults, parents of autistic children, and especially young autistic people themselves simply decided either not to access telehealth or telemedicine services, or to access them and then stop them altogether, because they felt that the therapeutic sessions have to be face-to-face. I need that personal interaction. Ultimately, it meant that many of our participants stopped receiving therapeutic services during that initial phase of the COVID-19 pandemic. Not because they weren't made available, but because of the way in which they were made available, as this autistic young person describes. So I interviewed this young person from acute psychiatric care. So they had entered acute psychiatric care 4 weeks after the pandemic hit. And they said, I stopped all of my psychologist appointments, which was a bad call, because if it's an online version of a medical appointment of any sort, I just dread it. And the dread is often worse than not being here. And it wasn't just that initial lockdown period. There's lots of evidence now in Australia and across the world you know, that the lockdown has had a detrimental impact on people's mental health, including autistic people and including young people. So this is just from one recent Australian study from the Australian and New Zealand Intensive Care Society, who highlighted an increase in paediatric intensive care unit admissions following deliberate self-harm, coinciding with the COVID-19 lockdowns and social restrictions of 2020 and 2021. And we can see this in our own. So this, again, I'll read through this, but just before. So we actually did a follow-up study with some of the participants that we saw during that initial phase. So with autistic adults, parents, and young people, we spoke to them during that initial phase, and then again, it was after they'd been through a 4-month extended lockdown towards the end of 2020. So it was like, in some sense, they hadn't come out of lockdown, these participants. And as you can see from this quote, these families were having, and people were having, a really tough time with clear negative impacts on people's mental health, compounded by lack of access to services. This quote comes from one autistic parent, and I'll read this out now. It's been a hot mess. I feel like we're coming out the other side of it now, but I feel like a period where it was really just about survival. We were in our area's huge wait list for child psychologists. Our whole hospital system, it's based around crisis, so we actually had to wait. Essentially, we didn't get triaged quickly enough until our middle child was suicidal and in crisis. And then we got in within a week. They tried starving themselves a few times, and mostly it was suicide ideation with massive breakdowns. And yes, and they're 8. It's heartbreaking to see that and to know that it's happening. And we were seeing our pediatrician. We had quick phone calls, but even there, it was nothing that they could do because the system's so backlogged. It was running the process to begin with. Now, so rather full-on quote to end this section on. I'm sorry about that. Yeah, but that was the reality of our participants' experience of that particularly extended lockdown. I just want to stop this part now. Remember, I said I was going to go into 2 parts. This is the kind of summary of that part, and I think our findings, rather, I think profound in many ways. In part because I think that reshapes some fundamental aspects of our views of autistic social cognition. On the positive side, we found that many participants reported, being glad that the relentless pressures of ordinary life had been lifted during those early months of the pandemic, and particularly people described how it freed them from the often overwhelming demands and expectations of a living in a neurotypical world. But on the negative side, many reported the decline in their or their children's overall sense of mental health and well-being. But perhaps what was most striking for us, our team, was that participants most missed those aspects of social life that the pandemic lockdown measures took away. And this was perhaps most striking because, as I've said, it flies in the face of so many common stereotypes of autism. Our participants mentioned again and again just how much they were missing their family during lockdown, and how they were also missing their neighbours, their local shopkeepers, and the general community. They also described missing the human contact that typically comes with much service provision, and felt that technological innovations like telehealth, telemedicine, at least it was as it was being delivered, were an inadequate substitute for face-to-face therapy and support. It also, I think the findings also have significant implications for our practice with autistic people, and especially for understanding what a good life, a flourishing life, might mean for them. But one issue is remaining, of course, is whether these kind of conclusions were reserved to our study alone, or whether they were part of a more general pattern. And that takes me to the second part of my talk, contribution, that I want to talk about. That's a scoping review that was published earlier this year, looking at the impact of the COVID-19 pandemic, specifically for autistic adults now, that I did with one of my colleagues, Mel Hayworth, who was on our original project, but two additional colleagues, Laura Crane and Anke Sheeran. And I'll just talk you through what we did for this project. So we essentially were interested in, what has been the impact of the COVID-19 pandemic on autistic adults, and which individual or contextual factors during the COVID-19 pandemic was more associated with a more positive outcome for autistic people. We did a scoping review. So a scoping review, for those of you who don't know, essentially it gives a broad review of the research that's going on in a particular area, and also looks for gaps in research. We did a systematic, in some ways it's still like a systematic research, so we did our proper literature review in various databases and search terms and all those kind of things, all to address those two questions. And I expected there to be, there might be like 15 papers or something we'll have to eventually look at. But I was very wrong about this. So this is you don't need to really look at this. This is how we selected our eligible reports. But we started off with, when you do a search, like loads of papers come up, and then you read all the titles or the abstracts and you realize they're actually not very relevant. And the ones that were relevant that we wanted to really include, they included 55. So there were 55 papers published in a very short time, so less than 2 years, on the COVID-19 and associated restrictions and autistic adults. And most of the studies, as you can see, took place in either the US or the UK. Only one study that we identified during that period, at least, was conducted in Canada. Most of the studies also collected data during the initial phase, so the kind of March to May or June in 2020. Most included self-report data from autistic adults. There was a preponderance of reports from women in particular. Only 9 of the 55 studies, so I think it's about 15%, focused on autistic adults with intellectual disabilities. So that's something to note. And even in those studies, they only really partly looked at autistic adults with intellectual disabilities perspectives. So that's just something to keep in mind, and I'll come back to that. So that's what we did. So what did we find? So these are the very descriptive results. So again, we were interested, if you think back to Tom Shakespeare's, what I talked about at the start, that triple Jeopardy of the COVID-19 pandemic. One of the things we were interested in was, what were the direct effects of COVID-19, so the virus itself. There weren't many studies on this, but what we did find was that there was an increased infection risk for COVID-19 and poorer health prognosis for autistic adults. Despite that, that increased risk, COVID-19 did not seem to be consistently, testing for COVID-19 didn't seem to be consistently prioritized. And it was a bit unclear from the studies that were done whether actually vaccinating autistic adults for COVID-19 was prioritized either. So they were the direct effects. Then we had Shakespeare's second theme, which was on the accessing services and supports. We found that there was a major disruption to services, not surprisingly. Lots of barriers to accessing healthcare, and there was mixed findings regarding acceptability of telehealth or telemedicine services. So some people, liked it, and the disability community has been, advocating for greater or more varied access, online access to healthcare services for years. So this was a good thing. But again, lots of people also didn't like, you know, these new online methods. And then we come to well-being, and again, perhaps unsurprisingly, lots of individual differences reported within the studies, and there were differences between individuals, as I described in the study that we'd done. So, you know, some autistic adults highlighted the benefits of the restrictions, so relief of pressure from, you know, the external world, control over kind of sensory environments, about able to spend quality time with family, for example, while others reported serious damaging effects of these same restrictions. So loss of social contacts and friendships, no access to professional support, and loss of independence. They also described kind of differences within individuals. So, you know, some autistic people just were experiencing both positive and negative effects of the stay-at-home orders at different points during the pandemic. The other thing to note, and these were the kind of the last thing you can see there, the column there is the positive kind of the contextual and personal factors, which seem to make a positive difference for autistic people. And that was, unsurprisingly, the continued access to formal support, a reduced sensory overload in their home environments, reduced pressure to conform to, you know, to societal norms and roles, a high perceived social support, so their social networks, the development of new routines, mental health prior to the pandemic seem to continue on with that mental health. So that's what we found. I'll come back to that in a second. But what's important to note was that we also assessed the quality of these studies. And we found, I think, unfortunately, that many of the identified studies were of relatively poor methodological quality. In fact, I think only 10 of the 55 we rated as good quality studies. And this is not this isn't isolated to autism research alone. You know, I think for many, you know, during COVID, researchers in any field had to be pragmatic. You know, they wanted to do research, but they couldn't do it in their usual way. So they had to make kind of logistical and practical decisions about how to do research. And they had to use particular designs. So they couldn't necessarily do a longitudinal study where you have a pre-test about people's mental health and have a post-test about people's mental health and compare that. Instead, they could only measure it as it was now and kind of ask people to think back about their previous experiences. But that is, you know, methodologically, it can be weak. And so, you know, these are the kind of things, I mean, we thought about when we were doing the review. Taken the quality of studies into account as we're reporting this. But this, I think the issues around quality are worrying because obviously, you know, conclusions based on less than sound science can pose significant challenges to clinical and and policy relevant decision making, and might also reduce trust in autism science. So just to kind of summarize, that demonstrated that autistic adults were likely to be disproportionately impacted by the COVID-19 pandemic. So there were increased risk of contracting COVID-19 itself and developing serious illness. They often struggled to access services and supports, and despite some positive uplift due to reduced external pressures, many experienced mental problems. I think what's really important to note that this is likely an underestimation of the pandemic's negative effects, given the selective study samples. So as I mentioned, you know, not very many studies at all examined the views and perspectives or experiences or mental health issues of autistic adults with additional intellectual disability. We don't know anything about those who are non or minimally speaking or who have high support needs. And so that's a huge kind of issue with the research as it is. But I think in those situations, it's probably these findings provide important evidence for Shakespeare and colleagues' Lancet that suggest, indicating a triple jeopardy face autistic people, just like disabled people more broadly. So that, in terms of the virus itself, and as a result of the government implemented measures used to curb the spread. So finally, I just want to end, this is the last slide, about the second last slide. Some of the lessons learned and what we can draw, from the review on the future care and support of autistic adults. We suggested that there should be a distinct strategy to support autistic people during times of crisis and beyond, and that this critically should be informed by the autistic community. Second, we suggested there should be greater investment in the development and rigorous testing of services and supports that are tailored to autistic people's needs and preferences. We also suggested more efforts to implement and maintain social support structures or networks for the autistic community. And again, this should be driven by the autistic community. And finally, we suggested that more participatory research should happen. We actually measured in our scoping review whether there was community involvement in the research that was being done. And over those 55 studies, not many studies had included autistic adults in the design and development of the research. And so we suggested, if we really want to get research that is aligned with the needs and priorities of autistic people, then that means working with autistic people themselves. So I hope it would be clear from everything that, my personal commitment coming out of the pandemic and all that has gone before it has been, is to make the possibilities of autistic flourishing, not just surviving or getting by, but actually thriving, more explicitly the centerpiece of my work. So trying to understand how we can ensure that, autistic people can lead truly flourishing lives, just as Danielle Allen called for. And to make this happen, all researchers, autistic and non-autistic, need to develop an agenda in partnership with autistic people of all backgrounds, with their families and communities. And how we do that is, of course, a talk for another time. Thank you very much.
Thank you so much, Liz. That was really interesting. Seeing the Australian, I remember seeing it on TV, the lockdown in the hotel in Melbourne. I will have some questions for you today if we have time here. You are involved in participatory research with autistic researchers. What are you working now that is non-COVID related?
Oh, that's a big question, Morella. So one of the things that so just to say, all of my research now is co-produced or co-designed or participatory in nature. So I work very closely with autistic researchers, autistic co-researchers, community members in my research, and that's because I really believe that my research is better because of that collaborative nature, and I think we get better autism science if we work in partnership with research experience and lived experience together. One of the things we're currently looking at is, and this is an idea that's been, or a notion that's been derived from autistic people themselves, the autistic community for many years now, is the notion of autistic inertia. So that idea of not being able to start something, but also not being able to stop something. So being in a kind of a state of inertia, and autistic people have described this since the 1990s, but there is actually only one study looking at inertia in the literature. And we started a study a few years ago. Again, it's fully co-produced. So I have an amazing team of autistic co-researchers who have designed a qualitative study looking at exactly that. So we've been looking at inertia, but also the sense of flow that might come from inertia. So the idea of not being able to stop and not being able to stop, because sometimes that's people are having a really joyful experience. So we're kind of looking at both the kind of disabling effects of inertia, but also the kind of potentially joyful experiences too. That's just one project.
I think Kaylin Rose coined inertia. I have another question. As protections going away and peeled away, anxiety remains as a psychological and real issue for autistic people and disabled people with co-occurring conditions. How do you deal with that lingering anxiety?
Yeah, another good question. I mean, I think, I think a first step is to try and understand what is underpinning the anxiety. Because, I mean, I know that, anxiety can be multifaceted, but for some autistic people and some friends and colleagues, in fact, they have a lingering anxiety about the virus itself and about their health, and so that's the kind of cause of their anxiety. Others, however, have found it really difficult to kind of re-enter kind of mainstream society, I guess, since kind of lockdowns have ceased, and having to do all the social stuff that they were relieved about having been taken away, and so I think in that sense it's really important. And some people have like all of those anxieties all together, and so I think that first step is to try and understand the cause of that anxiety, and also to I think to notice or to note that often that anxiety is not, I mean, obviously it's within the person because that person is anxious, but the anxiety is often triggered or emanates from beyond the person, so the environments that they're entering, and so it often is trying to, in my view, it should be trying to understand how we can accommodate or change those potential environments to make them more accessible and less anxiety provoking than they might be.
Thank you so much. Sorry to cut you off because we're at time here, but that was a good answer. Oh, you're frozen just at time. Oh boy. I would like to thank Liz, Dr. Liz Pellicano, for joining us today. And I thank everybody for joining, and of course the artists that gave permission for the virtual artists. Please check out all our events in the chat box, and we will be giving out the studies that Dr. Liz Pellicano talked. Thank you everyone for joining us, and we have a next one in May about the Outsider Theater, and June, Disability and Sexuality with Alan Martino.
Thank you so much, everyone.
Thank you. Sorry I cut you off.
No.